Welcome to this Global RPH lecture on loneliness. Loneliness has become a significant public health concern in recent years, with many experts referring to it as an epidemic. This video aims to explore the background of this issue, recent trends, and potential future developments. Additionally, it will examine the comments made by the U.S. Surgeon General regarding the loneliness epidemic and its impact on society. Loneliness is a complex emotional state characterized by a perceived lack of meaningful social connections. While it is a subjective experience, loneliness can have significant negative effects on both mental and physical health. The term loneliness epidemic has gained traction in recent years, as researchers and healthcare professionals have observed an increase in reported feelings of loneliness across various demographics. Historically, loneliness as a social issue is not new. However, the recognition of loneliness as a public health concern has grown significantly in the past few decades. In the 1980s and 1990s, researchers began to study the health impacts of social isolation and loneliness more extensively. As society became more individualistic and technology advanced, concerns about the potential for increased loneliness grew. Several factors have been identified as contributors to the loneliness epidemic, including changing family structures. As nuclear families become smaller and more dispersed, individuals may have fewer close family connections. The move towards urban living can lead to a sense of anonymity and disconnection from community. Technology. While digital connectivity has increased, it may not provide the same quality of social interaction as face-to-face encounters. Long working hours and increased job mobility can make it difficult to maintain stable social connections. Finally, the rise of social media has changed the nature of social interactions, potentially leading to feelings of inadequacy or isolation. As people live longer, they may experience more social losses and isolation in later life. Recent trends show increased awareness of loneliness as a public health issue. Governments and organizations are recognizing its importance, leading to more research and public discussions on the topic. Loneliness affects all age groups, not just older adults. Young adults, especially those aged 18 to 22, report high levels of loneliness, influenced by social media use and the transition to adulthood. Workplace loneliness has gained attention in recent years. With more people working remotely or in isolated office environments, workplace loneliness has become a significant concern for employers and employees alike. This trend has been exacerbated by the COVID-19 pandemic, which led to widespread remote work and social distancing measures. Research has increasingly focused on the link between loneliness and mental health issues, such as depression, anxiety, and suicidal ideation. Studies have shown that chronic loneliness can have similar health impacts to smoking or obesity, highlighting the need for intervention and prevention strategies. The role of technology in both contributing to and potentially alleviating loneliness has been a topic of much discussion. While some studies suggest that excessive use of social media and digital devices can increase feelings of loneliness, others have explored how technology can be used to connect isolated individuals and provide support. The COVID-19 pandemic has intensified loneliness trends. Social distancing and lockdowns increased isolation, bringing loneliness to the forefront of public health discussions. Future trends suggest a focus on prevention, with early intervention programs in schools and workplaces. Community-based approaches aim to foster social connections and mitigate loneliness. Healthcare systems may integrate loneliness screening in routine checkups, allowing earlier identification of at-risk individuals and more targeted interventions. As technology continues to advance, there may be more sophisticated digital tools and platforms designed to combat loneliness. These could include virtual reality social spaces, AI companions, or apps that facilitate meaningful in-person connections. Policy-level interventions may address loneliness through community programs, urban planning promoting social interaction, and regulations on technology use. Workplace strategies to combat loneliness might include redesigning office spaces, team-building activities, and policies supporting work-life balance and social connection. Intergenerational programs could increase, fostering connections between young people and older adults, combating age-related stereotypes, and promoting meaningful relationships. Loneliness treatment may integrate with mental health services, leading to holistic approaches addressing both psychological symptoms and social needs. Future research might explore biological mechanisms of loneliness, developing interventions targeting physiological effects of social isolation. Cultural shifts valuing social connection could emerge, influencing education systems, urban planning, and social norms to prioritize relationship building. Global collaboration on loneliness research and interventions may increase, sharing best practices and developing strategies to combat loneliness worldwide. The U.S. Surgeon General has played a significant role in bringing attention to the loneliness epidemic. In May 2023, Surgeon General Dr. Vivek Murthy released an advisory on the epidemic of loneliness and isolation in the United States. He characterized loneliness and social isolation as a public health crisis, emphasizing that they pose health risks comparable to smoking up to 15 cigarettes a day. The Surgeon General's advisory highlighted the economic costs of loneliness, estimating that social isolation among older adults costs the U.S. healthcare system nearly $7 billion in additional Medicare spending per year. He also emphasized the importance of addressing loneliness in the workplace, noting that it can lead to decreased productivity, lower job satisfaction, and higher turnover rates. While addressing the loneliness epidemic is crucial, several challenges and limitations must be considered. Loneliness is a subjective experience, making it challenging to measure accurately and consistently across different studies and populations. Perceptions and experiences of loneliness can vary significantly across cultures, making it difficult to develop universal interventions or strategies. There is often a stigma associated with admitting to feelings of loneliness, which can prevent individuals from seeking help or participating in research studies. While there is strong evidence linking loneliness to various health outcomes, establishing clear causal relationships can be challenging due to the complex nature of social relationships and health. The technology paradox. While technology can be used to combat loneliness, it can also contribute to social isolation. Finding the right balance in using technology to address loneliness remains a challenge. The long-term effectiveness of interventions to combat loneliness is not yet well established, as many studies focus on short-term outcomes. In conclusion, the loneliness epidemic represents a significant public health challenge that requires attention from healthcare professionals, policymakers, and society at large. Recent trends have highlighted the pervasive nature of loneliness across different age groups and social contexts, while future trends suggest a growing focus on prevention, technology-based solutions, and policy-level interventions. The Surgeon General's comments have brought national attention to this issue, emphasizing its importance and calling for a comprehensive strategy to address loneliness and build social connection. As research in this area continues to evolve, it will be crucial for healthcare professionals to stay informed about the latest findings and best practices for addressing loneliness in their patients and communities. Moving forward, addressing the loneliness epidemic will likely require a multifaceted approach that combines individual-level interventions, community-based programs, policy changes, and broader cultural shifts. By recognizing loneliness as a serious public health concern and working collaboratively to foster meaningful social connections, we can hope to mitigate its negative impacts and create a more connected, healthier society.
If you enjoyed this Global RPH production, please like and subscribe. Based on our incredible feedback, we are constantly releasing videos to our new channel. It is hard to believe it is only our first month.